Good morning, and thanks for joining us. It's hard to believe that we presented JDI's first webinar to address the impact of the pandemic on incarcerated survivors and hear from advocates how their work was affected by the pandemic over 2 months ago in early April. For JDI, the need to stay connected to the many advocates nationwide who continue to work on behalf of incarcerated survivors is greater than ever. We need to hear about the challenges you may be confronting in your efforts to provide services during this time to survivors in detention. We need to hear about the ways you've overcome barriers to help survivors know they're not forgotten, that they deserve to heal and are entitled to basic human rights. We welcome you today, and we're looking forward to the next 90 minutes with you. I am Matthew Van Winkle. I use he, him pronouns, and I am a senior program officer with JDI. I'm joined today by my colleagues, Nicole and Tanji.
Good morning, everyone. This is Nicole de la Torre. I use she, her pronouns, and I'm a program director in Washington, D.C.'s office.
Hi, my name is Tanji Reese. I use she, her, hers pronouns, and I'm a senior program officer in our LA office.
So, as many of you already know, Just Detention International, or JDI for short, is a health and human rights organization that seeks to end sexual abuse in all forms of detention. JDI carries out this mission by working with corrections officials, rape crisis advocates, and policymakers to make detention facilities safe, by promoting public attitudes that value the dignity and safety of people in detention, and by supporting incarcerated survivors of sexual abuse and sexual harassment. It's JDI's belief that when the government takes away someone's freedom, it takes on an absolute responsibility to protect that person's safety. No matter what crime someone may have committed, rape is not part of the penalty. And today's presentation is made possible by the Office on Violence Against Women, U.S. Department of Justice. We want to thank OVW for their generous support and for recognizing the importance of this work to keep all people safe, both in the community and in detention. And a word about self-care, I think, is in order, especially during times such as those we're living through right now. Whether you're at home, which seems likely, or somewhere else in an office, please remember to take deep breaths, stand up and stretch as needed during this webinar. Do little things that can help you feel better. We can't care for others if we aren't doing what is in our own power to keep ourselves together. So we encourage you to do that. Thank you. And we're hoping to hear from you today, as opposed to simply presenting to you. Similar to what we did in part one of this webinar in early April. We always gain tremendously from hearing from advocates in the field like yourselves, and this is a safe space for any and all questions pertaining to this work. So you can type any questions or comments you might have into the questions pane of the control panel. We'll be monitoring your questions as we go, and we've allotted time for answering them later on in the presentation. If we don't know the answer to any question today, we'll follow up with you privately at a later time after we've had a chance to do some research. This questions panel is also where you can answer share out questions that we'll be asking. And here's the first one. We would love to hear from you and have you tell us what is something you've discovered during this pandemic that you enjoy doing. You are also allowed to say nothing. All responses are valid here. We just wanted to hear from you if you had anything to share, and also kind of test this feature of the questions box. If you were not a viewer of part one, that is not a problem. There is nothing that we're going to present today that that you won't be able to get as just coming into part two. Puzzles, oh, that's great. Yeah, I've actually seen a lot of puzzling is really having a moment. Oh, and a love for running That's really good. Maybe I'll take some inspiration from that myself. I know I always think I'm going to run, and then by the end of the first block, I'm thinking, oh, this is terrible. So I'll give it another shot, Gwendolyn. Oh, great. So you are actually able to participate. Oh, this is an interesting benefit, actually. Marcy says she's able to participate in meetings and events that were once prohibited by travel, things that were once only in person. And if you couldn't make it to the location, you just couldn't go to the meeting. But now everyone's kind of, yeah, if you have an internet connection, you can be at any meeting. That's true. Spending more time with family. I hear that's very good, Mary. I can identify with that. As an introvert, staying home is not a problem. I hear you. Doing gardening and walking, slowing down and having minimal obligations, doing a lot of cooking, bartending and redecorating. Oh, that's great. Make your space just the way you want it. Now we have that extra time to do that. Oh, walking around outside during staff meetings. That is a huge benefit, to be able to be on a staff meeting and also out enjoying some air. Yeah. Cleaning and organizing. This is a recurring theme. Cooking. Yeah, some folks really do enjoy working from home. Video games, sewing, Star Trek Discovery. Ooh. It's very good to any opportunity we can to leave this leave this planet, even imaginatively, is starting to sound pretty good. And yeah, this is a loss. We are hearing here from Veronica. You really miss going out and seeing your clients. Yeah, no, we are social creatures. Thank you, everyone, for sharing. And I think we've confirmed that the questions box works. So that's really good. This is where you can ask your questions and do your share outs. So thank you. So our hopes for today's call are fairly simple. As always, we want to make sure to highlight the experience of incarcerated survivors of sexual abuse. Make sure that they're not forgotten in the larger ongoing conversation about sexual abuse and public health. We'll talk about how this crisis has changed the day-to-day lives of those in detention, particularly those who are survivors of sexual abuse and sexual harassment. We will present concrete tips on how to best provide counseling for survivors in detention during the pandemic, including tips on remote forensic exam accompaniment, which has quickly become a normal part of advocates' jobs in just the past few months. This is a subject we're covering because there were requests for this topic to be covered from advocates such as yourselves. Hopefully, some that requested it are with us here today. Yes, it was not traditionally the norm, but now it is the norm. Remote forensic exam accompaniment. And finally, we want to learn from you and let you hear and learn from each other as advocates all across the country, to hear what you're doing to maintain meaningful access to services for incarcerated survivors, and to strategize together ways to overcome the barriers that come up and will continue to come up. There will always be barriers. And now I want to share with you a quote from Frank Mendoza, a prisoner rape survivor and a member of JDI's Survivor Council. When Frank was assaulted by an officer, no one at the facility helped connect him with a victim advocate. As Frank puts it, if I had an advocate, it would have saved me so much grief. It would have helped me through that traumatic event immensely. Going through it alone, I didn't know who I could trust and who I could talk to about it, which appeared to be nobody. During this crisis, there may be many who are in detention who feel the same way. Remember that any support you can provide is helpful, and it lets survivors know that they're not alone. So just to recap some of what we discussed during the previous webinar, this is a bullet pointed list of some of the basics, and we'll be getting a little bit deeper into each of these topics as we go through today. So as we all know, visitation to most facilities has been halted until further notice. Staffing is reduced in many places, and that includes medical and mental health care workers who are sometimes being kept home or furloughed, and social distancing, which we're being urged to practice in the community, even when we protest. That's not possible in correctional facilities, and potentially life-saving products like hand sanitizer would be considered contraband inside if someone were to be found with it. But this barrier doesn't mean that rape crisis services will stop. It means that we should be more aware of how a lack of visitation and a lack of adequate staffing will have an effect on the folks living inside during the pandemic. The fact that they're looking at fewer staff on hand may be that staff, as a rule, are less responsive to your communications via email and via phone. Projects or things you've been discussing with them over the past few months may be put on hold temporarily. We urge you not to give up and to continue to stay in contact with them, to remind them that you're still here to serve incarcerated survivors via phone and mail, and that it's their legal obligation to allow you to do that. Staff may also be less responsive to incidents of harassment and violence that occur at their facilities because there are fewer staff and there are now kind of competing priorities. And this is going to have a very bad effect on those who are already survivors, survivors of ongoing abuse. They feel more cut off than ever, more isolated than ever. So it's important for them to continue to feel connected to the outside community. Things like letter writing and hotline calls are going to be even more important when it comes to staying in touch with your clients inside. However, it's important to keep in mind that there may be more barriers to accessing even these simple, formerly reliable means of communication because of the pandemic and potential restrictions that may be imposed by the facilities. And finally, this is something we've been hearing from a lot of writers who have written to JDI and callers who have called into JDI's hotline. The messages provided to the inmate population by the correctional department are sometimes confusing, and they may contradict best practices about how to stay healthy that they may be hearing on the television or radio or reading about, and that can compound feelings of stress, fatigue, and helplessness. They know that they're at greater risk. You know, there have been press reports of the dangers to those in prisons during this time, and it's, for some, it's extremely stressful, anxiety producing, and it seems like a very grim waiting game. So that's just something to really stay mindful of as you continue to reach out and try to connect with your clients who are incarcerated during this time, that there is an additional stress level there. And with that, I will hand over to Nicole.
Thank you so much, Matthew, and good afternoon or good morning to everyone listening in today. It's now been about 3 months since the country began to close down due to COVID-19. As Matthew recapped for us, we reviewed some of the impacts the pandemic was having on facilities during part 1 of this series in early April. Since then, we've learned a lot more about how incarcerated survivors are being impacted, and we wanted to share the most updated information we know, as it provides a helpful context for how we can provide services during this time. I also want to note that what we'll be sharing in this section is what we've heard from survivors that call and write to us here at JDI, as well as firsthand accounts from our correctional and advocacy partners from across the country. While it's a summary of what we're hearing from those sources, we suspect there are similar trends occurring in most correctional facilities. So before we get into it, we want to hear from you all who are in touch with survivors inside. So let's do another quick share out before we move on. Again, using the questions box that we used earlier. For those of you working with incarcerated survivors, what are you hearing from them about the effects of this pandemic? And if you're typically in communication with incarcerated survivors but have lost touch with them because of the pandemic, we also want to hear about that. So again, just please use the questions box to submit your answers, and I'll give you guys a couple seconds to respond. All right, so yeah, we're hearing people are unable to meet with their advocates. They're being told they're safer, safer inside, safer in jails than out of jail. Sorry. They're having to miss their groups, their domestic violence and sexual assault groups. Staff aren't consistently wearing PPE. They don't have a great sense of what's going on outside. Sexual harassment in particular has been a real problem. Yep. Communication is more difficult. Lots of fear and uncertainty. Yes. Wow. So one person shared that a CO has told them that they're going to be locked in their cells until there is a cure. And this person's client has severe PTSD and is barely hanging on. Wow. Yep. Many survivors are dealing with an increase of loneliness and frustration, issues with bathing access, worried about their families. Yeah, thank you all for sharing. Wow, we're getting a lot of messages, and unfortunately, we're hearing the same things, and so we're going to go a little bit deeper into some of these. But I appreciate all of those of you that shared. And sorry, I wasn't able to read all the answers out loud. But again, thank you for sharing. Okay, so just to provide some context in terms of numbers, according to the Marshall Project, as of June 2nd, were at least 40,656 cases of COVID-19 in US prisons, and that includes state and federal prisons. And of those, there's been 496 deaths. The states with the highest reported levels of COVID-19 in their prison systems currently are Texas, Ohio, Michigan, Tennessee, and California. And it's important to note that in addition to these states obviously having larger populations in general, their high numbers of positive COVID cases might be in part because some of those states have begun to aggressively test within their prison systems. However, like in the community, there are areas that have had less access to testing, especially when we talk about detention facilities, which have been behind on testing. So we do suspect that the overall number of COVID-19 may actually be much higher. And again, I just want to point out that this is only numbers for prisons. It doesn't take into account jails, juvenile facilities, immigration centers, and other types of detention facilities. Again, this data is from the Marshall Project, and they're regularly updating this data. So if you want to take a look at their state-by-state breakdown, you can go to the marshallproject.org. Okay, so let's talk about some of the environmental conditions we know are occurring in detention facilities right now. As we know, incarcerated survivors already have to deal with less control over their environment, including when it comes to their movement, housing, who they live with, when they can use the bathroom, when the lights are turned off, etc. The pandemic has exponentially increased that lack of control as facilities attempt to stop the spread of COVID-19 by limiting even more the movement of people, increasing the amount of time people are locked in their cells, and when and for how long they can go outdoors. Part of what we do as advocates when we talk to survivors in crisis is help them regain control over the things they are able to control, to empower them. This has become increasingly difficult during this time. Later in the webinar, my colleague Tanji will be sharing some tips on how to help survivors cope inside. Also, as Matthew mentioned, for months now, incarcerated survivors have not had access to visitation from loved ones and have lost programming opportunities, including educational classes, religious gatherings, and some health programs. And as some of you mentioned, even domestic violence and sexual abuse programs that they were regularly participating in. They've lost the ability to access their support systems and socialize, really deepening the sense of isolation for many. Furthermore, that loss of programming and changes in the facilities have completely eliminated any sense of routine for prisoners, something we know can be really vital in terms of coping skills for survivors of abuse, especially in incarceration settings, as they can provide stability and safety for folks. Just yesterday, a survivor shared with me how he was struggling to cope with bad news he had received about his appeal because he couldn't go for a run, which is something he's learned helps him clear his mind and process his emotions and is part of his regular routine now. So we'll be talking a little bit more about helping survivors with their routine in the context of COVID-19 in the next section. We also know that, like in the community, prisoners are being asked to socially distance from each other. However, in the context of detention settings, that can be an incredibly contradictory message. To be blunt, it's nearly impossible to keep social distance in a place that's overcrowded, especially when you don't have the ability to leave or move. As one survivor shared with me, how am I supposed to keep my distance when we all share bathrooms and I regularly have to sit in a toilet 1 foot away from the next guy? I do also want to point out that as a response to the pandemic, some facilities across the country have been trying to reduce their population by releasing people nearing the end of their sentence. And in some places, jails are allowing people who are awaiting trial to do so from home. But still, we know that overcrowding and inadequate conditions for social distancing continue to be the norm. Another major cause of anxiety amongst incarcerated survivors right now is the lack of access to information. In this time of social media and with many of us staying home, I know some of us are trying to eliminate the amount of news intake that we're exposed to. Unfortunately, what we're hearing from incarcerated survivors is usually the opposite. It's not necessarily new that prisoners have less access to information, but with less interaction and communication with the outside world, it's had a more profound impact. We've had survivors ask us for information, both in regards to what is happening inside facilities and outside facilities, because they feel completely out of the loop. I do want to recognize, however, that there are amazing efforts happening locally through rape crisis centers and community organizations to help inform the detained population. Basic information such as recommended guidelines for washing hands and common symptoms of COVID-19 are being mailed to incarcerated survivors. At times, this may be the only or most helpful information they receive. Aside from the potential physical implications of not being well informed, the lack of access to information is also taking a toll on prisoners' mental and emotional well-being. We've all heard and maybe experienced firsthand the terrifying stories of loved ones battling COVID-19 by themselves. Now imagine not being able to talk to those family members or even know they're battling the virus before it's too late. That's the predicament for many prisoners across the country. Let's talk a little bit about staffing now. For many agencies across the country, staffing shortages have been an ongoing issue even before the pandemic. As COVID-19 has spread, we've seen staffing become an even greater issue. Whether it's because of layoffs due to budget reallocations for relief efforts, staff getting sick themselves, or staff staying home to watch their loved ones, or because of their own fears of getting the virus. There's currently widespread staffing shortages in detention facilities. Even in agencies that have not been affected by staffing shortages, like in our communities, there have been shifts in agency resources to respond to the pandemic. We've seen this when, for example, an agency has to reallocate certain staff to COVID-specific duties, forcing them to have to neglect their regular responsibilities. Some of the ways we've seen this affect survivors the most is holds on their transfers, including step-down transfers when they've earned them for good behavior, for example, delays in responding to grievances, and less access to routine medical and mental health care, which, as we know, was already at capacity before the pandemic. Of course, the most pertinent effect in terms of our work that the pandemic has had in facilities is the increased risk for sexual abuse. The most obvious reason is that we just mentioned, that there's less supervision because of staffing shortages. Of course, that combined with the fact that people are confined to their cells for longer periods creates a dangerous situation for people locked in with potential perpetrators or when the perpetrators hold the keys. Another factor that creates a dangerous environment for abuse is the scarcity of basic goods such as soap and other hygiene products. We know some agencies are being diligent about providing supplies, but for those prisoners and places that are not, they sometimes depend on their jobs or income from the outside to pay for those goods. When those funds are unavailable because they can no longer work and or their family members are struggling to make ends meet, there's a greater likelihood that people may be sexually exploited for these goods. As someone mentioned in our question earlier, we've also heard that because there's an increased stress amongst prisoners and staff, um, people are sort of at the end of their ropes, and there's been an increase in the use of inappropriate and degrading language or sexual harassment. Lastly, and probably most significant, is that reporting sexual abuse has become more difficult. Again, we know people have less access to staff, to the outside world, and that grievances are sometimes not being responded to in a timely manner. An environment where people don't have access to reporting is an unsafe environment for all. So now that we've shared some of what we know is going on behind bars, we're going to switch over to how we can continue to support survivors during this time. Given what we know, this is a critical time for survivors, and your services are more important than ever. As we mentioned earlier, JDI operates an emotional support line for incarcerated survivors, and we also have a robust correspondence program across the country. Luckily, we've been able to keep both these programs running during this time. So I'm going to welcome my colleague Tanji Reese now, who will be sharing some counseling tips that have been successful for us.
Thank you, Nicole. In part one, we discussed the importance of continuing to provide support services to incarcerated survivors during this time of the pandemic. Today, we'd like to go a little more in depth into how the needs of survivors might look a little bit different during this time and how you as advocates can support them in your communications through phone and writing. First, let's do a share out. How has your ability to provide services been impacted by the pandemic? Feel free to share your responses in the questions pane of the control panel. So in the control question part, you can put in some of the ways that your ability to provide service has been impacted. So no visitation. Yeah, we've been seeing that too. Some places are just now starting to allow limited visitation. Mostly with letters. So doing video visits with jail clients, and one client really gets the ability to connect to CoreLink. So we've been hearing that too. A lot of people don't even have access to communication. So some things you can't take into the prisons to help with services. There haven't been support services in March. Not being able to go in the facility and having to do everything over mail, and a big drop off. We've seen some decline in some of our hotline calls as well. Not being able to meet again, contacting only by phone, mostly with letter writing and hotline. So no visits and volunteers, no in person, having to do things over the phone, mail being held back. So a lot of the same, excuse me, a lot of the same things you all are experiencing, we've been experiencing too. Overall, there have been big delays in phone calls, but also, like you all mentioned, in visitations too. So there's no doubt that many services have had to change and they may continue to change. As advocates, it's important to recognize what has impacted your services and ensure you're able to still provide them. In order to maintain services, it's important to understand how the facility has changed and ask proactive questions about potential barriers. Some questions you may want to ask your agency contacts are, what access do prisoners have to phones? You may also want to ask if there are phone limitations or changes to phone availability. Given the uncertainty that phones will be sanitized regularly, it's possible that inmates may not want to use the phone. It may be helpful to ask what sanitary precautions are being taken for the phones. Overall, there have been delays in mail. For written correspondence, you may want to ask if there have been any changes to incoming and outgoing mail practices at their facility. Or ask staff who will communicate via phone or letter with incarcerated survivors know the best current practices to ensure letters are delivered successfully and in most confidential manner possible. You also want to maintain open communication with facilities uh, to maintain your services. Once you understand the changes in the facility, think about how they affect your ability to provide service. Flexibility and creativity are essential. Once you identify what services you're able to maintain, think about how you provide services may change. It's possible that inmates you work with may reach out because worries about related to the pandemic. Where you typically may offer resources or problem solve, you may want to focus more on crisis intervention. First, provide validation regarding fears about the current crisis. Acknowledge difficult emotions like fear, disappointment, and sadness. Encourage the survivor to notice the emotions and what they do with their body, mind, and thoughts, and find the best solution to acknowledge those feelings. For example, if it's a physical sensation, they can do something physical to take care of their body. Or if it's an emotional response, they can do something caring for themselves or something that connects them with others. Encourage them to be gentle with themselves and remind them that stress is expected. So it's okay if that's what they're feeling. Changes in routines within facilities are inevitable. When providing emotional support, acknowledge the importance of routines and validate the current disruption of the regular one. For some folks, they may be losing programming or even spend more time in their cell. If their schedule is disrupted or if they're on lockdown, encourage them to make a schedule anyway. Some ways to do this is by getting up and going to sleep at the same time every day. Setting aside time to write, do art, create plans for the future, exercise, read, watch TV, or listen to music. Keep in mind that their routine is dependent on what they have access to. Think through options with them and don't make assumptions. They may not be able to do things that they've done in the past, and this is an opportunity for them to be creative. Remind them to schedule self care, rest, meditation, and connecting with others when possible. Lastly, be sure to share information whenever it's appropriate and possible. None of us have clear information on how long this will last, the value of masks, or when testing might be available for everyone. The only thing we know is that this is a dangerous virus and the facts are always evolving. Encourage the survivors you work with to pay attention to information on how to keep themselves as safe as possible within the resources available to them. Encourage them to take precautions seriously and ask staff questions. Additionally, remind them to be careful about spending too much time taking in stressful information. Promote balance between taking in information and doing less stressful activities. If they become preemptively sick, you may also want to talk through how they can advocate for themselves. Remember that your support and service may be the survivor's only connection to the outside. Because of this, be open and honest about limitations to services. For example, there might be a change in response time for letters, decreased hotline hours, and less capacity to advocate. If you sense there may be gaps in your services or major changes, think creatively about how survivors can stay connected to you. Try using other staff resources at your agency. For example, if you have a lawyer on staff, have survivors write to them via legal mail. This will alleviate postage barriers and keep their concerns more confidential. If your organization has a newsletter for outreach, add survivors to your mailing list and include updates about your service capacity or tips for coping during the pandemic. This is a rare time when we're literally all in this together. Inside or out, trauma makes us internalize stress. As counselors, we can externalize what's happening while not minimizing how folks are feeling. Reassure them that one thing that is consistent is that you are still able to provide support to them, and you're committed to continuing to work with them during and beyond the crisis. Here's a quote from one of our frequent callers. An inside line is a godsend, and no matter what I say about my feelings and how I process them, you always talk to me with a listening ear and an open heart. You make me feel welcome and safe when I call. I don't need to hide my emotions when I speak with all the people on the line. As you navigate through adjusting your services, remember that anything you do has impact.
Thank you very much, Tanji. I know what resonated with me that you just mentioned is suggesting to clients that you place limits on some of the information you take in. I think that's a good piece of advice that we can all take a bit to heart. So now we'll pivot to discussing how to best provide support for incarcerated survivors during remote forensic exams. This is a topic, as I mentioned earlier, that we've heard from many advocates that they want to hear explored. And whereas prior to the pandemic, remote forensic accompaniment was a rare occurrence, now an advocate's voice on the phone is the primary way that incarcerated survivors of sexual abuse receive accompaniment during forensic exams, which that accompaniment, of course, they are entitled to by the PREA standards. And this represents a very big shift, the shift from in-person to tele-advocacy or telephone accompaniment, not only for survivors, but also for advocates. So we hope we're able to speak to some of the need for training around this, which many of you have expressed. We're going to share some of what we know to be best practice, and we're also going to hear from a guest who has been performing remote forensic accompaniments. We'll also encourage you to keep sharing your own experiences in the question box, as well as any questions that you might want to ask our guest. So let's begin with a quick poll to see the range of experiences among us today. You should see the poll on your screen. We're interested in knowing how your agency is handling forensic exam accompaniment for incarcerated survivors during the pandemic. So just select the appropriate response and click submit. Seeing some clicking happening, and we have about 20% having responded. Try to get a little bit of a bigger sample group before I end the poll. All right, seems to have petered out here, so I'll share out the results. So it looks like, for the most part, this is not applicable. 46% of those who responded simply said you're not being called by corrections facilities to do accompaniment. So it's possible that exams are happening, but you're just not being called, which is something we would definitely urge you to make sure is not happening. If you're, if it's crickets, it's really important to get in touch with your PREA contacts at the facility and make sure that if exams are continuing to happen, that you, as PREA requires, are a part of that process. Yeah, it is alarming when you're just not getting any calls at all. That does not mean that abuse is not happening. It means that there's an access problem. Looks like the next largest group of you all, 32% of responders said that you were doing remote accompaniment via phone, which is great. And that's mostly what we're going to be talking about here today with our guest, Amanda, who I'll introduce in just a moment. 12% are continuing to provide in-person accompaniment as before. That's great. Of course, we always urge you to do whatever you need to do in terms of following health precautions that are suggested by the hospital or by your agency. We hope, we're certain that you are, and we're happy that you're able to continue to doing that, those in-person accompaniments. And a small percentage are doing remote accompaniment via video. That is really good to hear. And I know that has some overlap with how to do accompaniment via phone as well, with the added benefit, I guess, of being able to exchange a smile, or just make sure that you have your face to help communicate with the survivor as well. So thank you all for participating in that poll. So as we continue to provide services to incarcerated survivors remotely, it's important to think about how we might need to adjust them to respond to this time. a big question for advocates and agencies, especially in states where there are greater restrictions on movement right now, is forensic exam accompaniment. And as you know, basics, always follow the protocol set by your state, by your agency, by your coalition. I think our big point when we are talking about specifically serving incarcerated survivors via forensic exam accompaniment is that we'd like to see agencies have a consistent level of care and involvement for people who are incarcerated, just as they would for people in the community. So if you are still providing in-person accompaniment for community survivors, continue to do that for incarcerated survivors as well. We don't want to treat them as different or other than. And if you're doing phone accompaniment for community survivors, then we would urge you to do that for incarcerated survivors as well. We know that there are fewer accompaniments overall during this period. Some agencies, which is another important thing to remember, they're having the forensic nurse complete a release of information with the survivor, enabling the advocate or the agency to establish follow-up contact with the survivor after the exam. That's an important piece. And if you're doing that with the ROI, make sure that it includes letters as a means of follow-up, because you're not able to make a phone call to clients who are in detention. We know that I think whatever your agency is doing, we want to make sure that you're in communication with the correctional facilities in your area so that they know what you're offering and that they can be prepared, that they know you're waiting for that call if they do have the need for a forensic exam for one of the folks housed at the facility, that they know that you're ready, available, and waiting, and that they know the means by which you'll be providing accompaniment, whether that is in person or whether that is one of the remote forms that we discussed earlier. And now I'm very pleased to welcome Amanda Drapcho. Amanda is the Medical Advocacy Coordinator at the Boston Area Rape Crisis Center, known as BARC, where she coordinates over 50 volunteers to meet survivors in 19 area hospitals following sexual assault. During COVID-19, BARC has switched to offering phone tele-advocacy. Amanda, are you there?
Yes, thank you so much for having me, and thank you to everyone who's on this webinar today for all of your important work.
And thank you for joining us. And can you tell us a little bit about BARC and the role you play in Massachusetts? Yeah.
Absolutely. So the Boston Area Rape Crisis Center was founded in 1973, and our client-facing departments include counseling, case management, legal, prevention and education, the Incarcerated Survivor Support Program, a web and chat hotline, and medical advocacy. And we have a staff of roughly 50 and about 200 volunteers, and we serve the greater Boston area, which includes 29 cities and towns.
Wow, that's a big. You have a big umbrella there that you hold over the state. That's and that's a big staff as well. So I guess let's talk maybe about try to see how things have changed. We can see here on the screen that BARC has some correctional facilities in its service area. The entire Massachusetts Department of Corrections. And how many prisons is that off? Do you know?
So I do know that we work with the Department of Correction, our state prison system, and 2 of our local county sheriffs, Suffolk County and Norfolk County.
Okay. And you're doing, I guess, typically your normal services are as listed here, the hotline, mail correspondence, forensic accompaniment, as well as some inmate education programs and TTA provided to the staff at the facilities, right?
Yes.
That's great. That's a very robust program. And about how often would you get outreach from incarcerated survivors before the pandemic via phone call or letter?
Yeah, so during this fiscal year, and so for us, that's July 1 through June 30th, I'm going to talk a little bit about medical advocacy and then about the Incarcerated Survivor Support Program. So for medical advocacy, we responded to approximately 4 male-identified incarcerated survivors pre-COVID during this year. And of those 4 survivors, 3 of those survivors wanted us to stay and provide advocacy. And so to give an idea what that looks like in terms of our overall numbers, prior to moving to teleadvocacy, this fiscal year responded to about 364 cases. One of the main programs for the Incarcerated Survivor Support Program is their hotline. And so in January of 2020, they received about 89 calls from incarcerated survivors, and in February, they received 69.
Okay, that's you were definitely hearing from folks. That's a pretty steady flow. And has there been, what have you seen, I guess, since the pandemic or mid-March?
Yeah, so I think similar to what a lot of folks have expressed, for medical advocacy, we have unfortunately not seen any incarcerated survivors in the hospital during the pandemic, and the Incarcerated Survivors Support Program has also seen their volume dramatically decrease. So in March, they had around 53 calls, and then we really saw a dip in April that dipped down to 14 calls on their hotline.
Wow, yeah, that's a very big drop. I know that I think Tanji mentioned that there can be kind of a fear around maybe using the phones, touching the phones. Do you think that that's part of the reason for this drop, or are there other factors that go into it?
Yeah, so some of the things that our Incarcerated Survivor Support Program are hearing is that, yep, people are afraid of touching the phones and kind of concerned about how often they're clean. Also, we've heard about, with many incarcerated survivors being, having limited access. If they're on lockdown, they really have limited time to make all the phone calls that they may need to. There's also a big concern we heard about the limited amount of information being provided to them about COVID, and then possible concerns about kind of transmission if needed to transport survivors to the hospital for a sexual assault evidence collection kit.
Yeah, that all makes a lot of sense, especially if folks are aware of what's going on. I think we can all identify with maybe a disinclination to use the community phone or to be taken out to a hospital where people might be treated who are ill. Here on the screen, we've put together a very brief chart, by no means exhaustive, not intended to be exhaustive, but just kind of laying out some of the differences between that Amanda had kind of highlighted during a previous conversation of how in-person accompaniment can differ as opposed to this tele-accompaniment. We can see that there's obviously a big change in the amount of time that an advocate is spending directly with the survivor. For lack of a better word, tools that the advocate has at their disposal, such as eye contact, non-verbally showing support. Those are kind of not available via the phone. And as Amanda just mentioned, here we can see that whereas before you could kind of delve into emotional needs of the survivor, now that is seen as almost a secondary priority by the survivor themselves, who just really does not want to spend any more time in that hospital than they need to. And that's about right. Did I misinterpret anything there, Amanda?
No, that's exactly right in what we're hearing.
Mm-hmm. So what was the first day that BARC started doing the tele-advocacy?
Yeah, so we started on March 11th. And to give you an idea of kind of what that's looked like since then, I think we're on week 13 now. During that time, we've had 58 pages in total. So that's where one of our hospitals alerts our sexual assault nurse examiner program and BARC of a sexual assault case. And of those 58 cases, we've been able to speak directly with a client about 17 times.
Okay, yeah, that's again, that's less than your usual flow, but it's good that you've been able to be there. I want to be clear too that these are not this teleadvocacy that you provided has not been for incarcerated survivors, even though that is, of course, JDI's mission. But I think some of what we're going to talk about here is it very easily applies to any teleadvocacy accompaniment. Kind of getting concrete for a minute, what does teleadvocacy look like from the survivor's perspective? Well, like if you're the survivor and you arrive at this hospital, of course, in the case of an incarcerated survivor, you wouldn't have your own phone. So how is this contact established? What's kind of the play-by-play?
Yeah, so we're getting the initial page from the hospital, and then one of our medical advocates is calling back the hospital and letting them know that we can provide advocacy over the phone. And then the hospital is checking in with the survivor to see if that's something that they would prefer. If that is the case, then we are kind of troubleshooting with the hospital on what that looks like. So oftentimes that might be a cordless hospital phone, a staff cell phone, or the survivor's personal phone, or a phone that's in the emergency room that the survivor is located in.
Mm-hmm. And I know that BARC, as we mentioned above, partners with many hospitals, and I guess you have some key relationships there with staff at each one to kind of make sure that this is a smooth process.
Yeah, and it's definitely something I would recommend if you're thinking about this or doing it in some way, is really having that one contact. So whether that's someone in a violence prevention and recovery program, a social worker, or someone placed in the ED, to really kind of check in, talk about how it's going, and troubleshoot some possibilities.
Got it. And when it comes to, I guess, just to go back a little bit to the new concerns around just being in a medical environment for people. Can you talk a little bit more about how you're staying flexible with the kind of support that you're providing, like language you're using, or even the amount that you're saying?
Yeah, I think it's a great question. I think for us, one of the things that we've had to be really mindful of is really shortening our scripts. So before, when we were going to the hospital, we could kind of take some time, build that rapport. And now it's really thinking through what are the main priorities for the survivor. So kind of asking them, like, what are your main concerns? What can we help you with today? Is always a question that we try to ask, but we do that kind of a little bit earlier. And then really helping them to think through, what does it look like to connect to us further? So you may not have the amount of time to really talk through all your services. So how are you providing that hotline number? And what are the few takeaways that you can provide them? So that's been really important to us, is to think through kind of what do we really want to get across? And then matching where the survivor's at. If they just want to talk about, prophylaxis, like that's what we're going to be talking about, and not trying to think through other things that might be useful. Really kind of taking the lead from the survivor, which is something that we're always trying to do, but really now more focusing on that. The other thing we would say is really maintaining those good relationships with the sexual assault nurse examiner program. They can also really serve as a liaison and really provide that trauma-informed care. And so that's been really helpful if we're not able to get in contact with a survivor, or we're cut short, is really talking with our partners on what are some things that they can talk through, what are some things that they can augment the conversation with. We've also found that being able to talk to a survivor at the beginning and at the end of an exam has really helped to both think about, okay, how do you want to spend your time today? And then coming back and saying, okay, so what are our next steps? How do we kind of do maybe some immediate safety planning, or how do we connect later?
Mm-hmm. That makes a lot of sense to me. I think, yeah, like the idea of a kind of a before and after bookending the exam experience is a very, very good thing to do. Again, like, I'm sure it's not always going to be possible in every case, but having that good relationship that you mentioned with your SANE is going to definitely make that more likely. Amanda, I can't remember if I had asked you earlier, and it seems like a pretty obvious question I should have asked, but does your SANE, do you have literature like that they would be able to pass along to the survivor, or are there BARC pamphlets or brochures that they can give if you're not there?
Yeah, so that is one thing that we definitely recommend. And thinking through for your specific survivors, what can they bring back? What can you provide to a correctional officer to provide to a survivor later? So we have big BARC pamphlets that we've sent to all of our hospitals during COVID-19 so that they can kind of grab those and give them to a survivor. SANE also has them. Typically there's also a lot of pamphlets that are involved with the evidence collection kit. So maybe taking time to say, hey, do you go through those? Can you kind of highlight some of these resources? If you have any grounding techniques or maybe anything that you would put on a worksheet, can that be sent to the hospital and asking that contact to kind of either put them in the same cart or provide them to the survivor as well?
Good, that makes sense. And I think I don't want to leave this conversation without talking a bit about confidentiality. It's obviously always it's always probably a difficult environment, especially when the survivor is incarcerated, and then there are facility staff present at the exam during the meeting with the advocate. But just during the remote portion that you've been talking about, have you had any instances where survivor confidentiality was particularly difficult to maintain or in jeopardy?
Yeah, so we had one case where it ended up being fine because it was really the choice of the survivor. But we were talking to a survivor whose parent was in the room, and they were a little bit older of a survivor, but their parent was with them, and we didn't necessarily know that. And it worked out fine because it was a survivor who had their cell phone on speaker, and they wanted the other individual to hear that conversation. So it would have mirrored similar if we were in the hospital and a parent was in the room. But some things that I think we've been thinking through, and one of the things that we started doing is just asking the survivor to introduce themselves and anyone else that might be in the room so that you understand really who's present for that conversation. I think similar is thinking through how can you make that conversation safer? So and having that conversation with a survivor. So saying, would you like me to just provide information and you don't have to speak? Would you like to just answer in yes or no's? How can we frame this conversation? If your survivor may not have the use of to be able to hold the phone, do you have like maybe disposable headsets that you can give to kind of ensure some of that privacy and people aren't really hearing the conversation? So I think definitely something to think through. What are going to be your limits to confidentiality, and what is some technology? What are some ways that you can kind of really ensure that, or at least know who's in the room, and then how does a survivor want you to tailor the conversation to be aware that they may not have complete privacy?
That makes a lot of sense. Well, Amanda, is there anything else that you'd like to say? I should mention, I should ask you, will you be available to kind of hang in there, and during the question period, will you be able to answer some questions that may come up pertaining to your experience and what you're doing at BARC?
Yeah, absolutely.
Okay, that's good to know. Yeah.
Yeah.
Are there any final thoughts? Yeah.
Yeah, so I think, it sounds slightly pessimistic, but I think it's helpful, is really plan for something to go wrong and know what your limitations are. And so thinking through every step of the way, having a plan B, a plan C. What are your services for interpretation? What are services if you're not able to connect with a survivor? And so really thinking through your population that you're working with, your PREA contacts or the Department of Corrections, understanding how can you adjust during this time and what are your limitations. I think the other thing to say is that, hospitals have also had to be really creative. And so they may have a technology or they may have a solution as well that they might be able to work with you on.
Thank you so much. And thank you for joining us today.
Thank you.
And as we mentioned, Amanda will be hanging in there with us. If you have any questions for her or to know how they're doing things at BARC, please write it into the questions pane. And just to kind of summarize, You're going to want to provide information about your programs, how to access them to the sane nurse. You should have a very, very strong relationship with that person. You'll want to make sure that because you're not there, folks can't see your face, they can't read your lips. Make sure that you're very clear and well-spoken, very deliberate in your enunciation. And you have lots of ways to make sure that that follow-up contact happens. So we'd also urge you to continue to look at local detention facilities in your area's websites. Whereas before you may have been having a meeting monthly with them for SART meetings, it now may be a Zoom meeting or a phone call, or I'll be honest with you, it may not be happening at all any longer because priorities have shifted. But we would urge you to do a little bit of sleuthing on your own to see how they are handling the pandemic internally. And that can help you kind of know potential concerns, potential barriers, and give you some, can kind of guide some conversations with them. So this is just a screenshot from the California Department of Corrections and Rehabilitation website, which now has an FAQ section for the pandemic. So it's definitely worth looking at your local corrections facilities web pages to see if they're doing any similar messaging. And I wanted to end this section with a little bit of encouragement. So this is a photo recently shared with us from RISE, a California Rape Crisis Center that's been working in their local state prison, the California Men's Colony. And last month, advocates at RISE's office were pleasantly surprised by a visit from state prison staff who were delivering Krispy Kreme donuts to partners in the community that they deemed essential workers in keeping their facility safe. So it gave us a smile to see this, and I hope it helps you feel even more confident in the fact that you are essential, you are appreciated, you are needed. And with that, I'll turn it back over to Nicole.
Thank you so much, Matthew and Amanda. That was a super helpful conversation. And I just want to recognize the amazing work you guys are doing at BARC for incarcerated survivors in 20 different prisons and jails, which is really remarkable. And again, that's 20 prisons and jails in Massachusetts, to be specific. So thank you for joining us today. So we've covered a lot during today's webinar about the current conditions behind bars and how we can best support survivors during this time. But one thing this pandemic has taught us is that we have to be flexible, especially given the unpredictability of the future. So let's have a discussion about what's next. When facilities will reopen to advocates or even return to normal operations is still very much an unknown. But what we do know is that providing support services to incarcerated survivors during this time is critical. If you don't already have a plan of action for doing this work during the pandemic, do it now. Regardless of when states begin to open, detention facilities will likely take longer to open for outsiders. It's also possible that we will see this happen again, whether it's another wave of COVID-19 or another national or local crisis. It's important to be prepared. You'll want to consider what your agency's capacity is to expand or change the services you provide. Think about whether you can provide video conferencing services instead of in-person services you were providing before. I was really happy to see several of you mention that in your comments earlier that you were doing that. Can you use e-messages such as email or JPay to communicate with survivors? And have you talked to your correctional partners about this? Do they have the capacity for video conferencing, or are there other methods of communication that they can suggest? Take the opportunity to enhance your written correspondence program. As Tanju mentioned earlier, written communication can be done so in a very meaningful way. And I know a couple of you also mentioned some confidentiality concerns with that, which are really valid, and I'll touch on that in a second. So yeah, of course, make sure to think about privacy and confidentiality considerations for any new services. For example, make sure to ask what level of monitoring happens with emails and mail, or what type of privacy are survivors afforded when they talk to you over the phone or a video. Again, several of you mentioned today that it's been an issue in terms of confidentiality. specifically that phones are being monitored and or recorded. And these can be really difficult conversations to have with your correctional partners, but having unrecorded and unmonitored calls is possible. So if you're getting a lot of resistance on that and JDI can assist you in any way, please do reach out to us and we'll share our contact information in a later slide. But this is something we've had numerous conversations with correctional officials with and provided TA for advocates on. So please do reach out. And although facilities are responsible to inform prisoners to the extent that any communication is not confidential, it's always best practice for you to share that information with your clients as well. Also, continue to stay in touch with your partnering agencies and stress the importance of your services during this time when conditions are more dangerous for survivors. We realize this isn't possible in a lot of cases. We've heard from advocates across the country who are trying to stay connected with their partners and are getting no response from facilities. And even those who have been able to connect, officials just don't always have the answers. We know that many of correctional partners are really busy and wear multiple hats even before the pandemic and are certainly busier now. And we know there's a lot of agencies that have just always struggled in terms of communication with correctional partners. So we definitely recognize, but to the degree that you are able to stay in touch with them, please do so. It's such an important thing to maintain those relationships. Lastly, this is an amazing time to build up your networks. There may be other organizations that have more access to survivors behind bars, and you may be able to collaborate with them, or they may be able to help you spread the word about your services. Truly, survivors only stand to benefit from organizations working together and supporting each other. Okay, well, that actually wraps up the substantive part of our presentation, and we'll be moving on to questions soon. But before that, we want to end with one more share out. So what are your next steps in terms of working with incarcerated survivors and supporting them through this time? What seems possible? And also feel free to share any additional ideas or creative strategies your organizations are using to support survivors during this time. Again, we all benefit from learning from each other. So we'll give you a couple of seconds to do that. And again, as a reminder, just put your answers in the questions box. Great, so I see some of you are saying maintain open communication and contact with your partners. That's great. Checking in with our facilities to get updated info on their capacity and options to provide services. We've had radio silence since the pandemic. Yeah, I'm really sorry to hear that. And fortunately, I can't say I'm surprised. We've had similar issues with some of our partners. It's just been a really hard time for. Provide more time for webinar trainings, great. Maintain open communication again. Continue to work closely with our system so our people receive the best care. Conversations and more conversations with staffing, love that. As staff, we've been working out of the office. We've had issues with phones being transferred. We've set up 2 direct line to give our incarcerated clients so they can speak directly with our advocates. That's great. Contact and follow up each facility. Contact their PREA coordinator to open and reopen communication, build and rebuild relationships. Love that. It's amazing to see how committed everyone is on this webinar today to survivors behind bars. So I really appreciate all of you sharing these wonderful next steps. It's really great to hear. All right, so I think with that, we'll pass it back to Matthew, who's going to be facilitating our Q&A. And as a reminder, if you have any questions and haven't sent them to us, now's the time. So back to you, Matthew.
Thanks, Nicole, and thank you again to everyone who's been really very generous with questions. Thank you very much. And I know we do, as I mentioned before, we do still have Amanda here with us if there are any questions that that come up that that she might be able to speak to. Um, this is a question that we received earlier on in the presentation. Please talk to how we can work with other groups on COVID human rights violations in the facilities. I'm assuming you mean groups such as like the ACLU, people like that who are working to advocate. I think you could. I'm not sure where you're located, Carolyn. And if anyone has a better answer than the one I'm about to provide, please do jump in. I would think you could start, locally, finding a local branch or maybe the state branch of the ACLU, and letting them know, kind of your role, the piece of healing that your agency holds for folks who are survivors behind bars, and let them know that you want to partner. That seems like a pretty inadequate answer to me. That would be where I would start. Tanji or Nicole or Amanda, do you have anything to add to my answer?
Yeah, that's also what I was going to suggest, Matthew. And in terms of the national level, specifically with the ACLU, they have the National Prison Project, which might be a really great resource. But I think in general, yeah, just trying to connect. There's efforts happening locally, state level, and at the national level on this issue. And so, I think just reaching out to those organizations and getting connected. I know JDI, for example, has been asked to sign on to various different letters asking for better conditions and addressing some of the human rights conditions in prisons and jails. So I think there's definitely a lot of things going on that you can certainly support. And thanks for asking that question and having that conversation.
And a question here from Deborah that might be for Bark is, can you share more about what the inmate education program is, programming that you do? And Amanda, this might not be your role exactly. Is that right?
Yeah, that is correct, but I'm really happy that you're asking that question. And what I'd love to do is kind of get your contact information from our wonderful host, and I can connect you after this to our incarcerated survivors support program, who are going to be the experts for that answer.
Great, and I do know I am in contact with Deborah, so I'll make sure to connect you both after the webinar today, Amanda. Yeah, let's see. Still looking. If anyone has any more questions, I am doing a scan here and I'm not seeing too much that we have not covered already. There was a question regarding the hold on transfers to prisons from jails that was in place in California. And if anyone else is unaware, I believe that hold is lifted. There was some press coverage back in the second half of May that announced that inmates at jails were again being transferred out to their sentencing facilities at the California State Prison level. So that does appear to be returning to normalcy, maybe prematurely, but
So I know we had a question earlier about grounding techniques and thinking through ones that could be useful in the hospital context. I don't know, Tanji, if you had any additional thoughts on that.
Yeah, so it's possible, even if a person is going to a hospital to get a forensic exam, that they may still be feeling anxiety about actually being in a hospital, which I know a lot of folks are. I can speak personally. I know my doctor's office has talked about having less people there just because of concerns about COVID-19 and the pandemic. So I think some of the same grounding techniques that you would use over the phone can be used at a hospital too, and it might be even easier. One technique is just getting folks in touch with their senses. So finding 5 things, that they can look at and describe in detail can help to ground them. Another thing too is if you're accompanying them, asking doctors to explain things a couple times and then even repeating back things if a doctor or nurse leaves, and just doing whatever you can to continue to make the person feel comfortable and safe. Breathing techniques are also another thing that can be really helpful while in the hospital.
Yeah, that's great.
If I can jump in there as well, just had a few others that Wentanji was thinking through some things that BARC have used as well. So kind of similar to the senses, we also do like colors. So count 5 yellow things in the room, count 5 blue things in the room. Progressive muscle relaxation, so kind of tightening different areas of your body can kind of really help to center you in your body and think through kind of what steps you want to take with the exam that can be really positive. And then this one I think is often, it's really simple, but sometimes overlooked, is just really repeating the survivor's name throughout your conversation with them and really bringing them back to like that's your focus. So I also just wanted to mention a few of those that we found to be helpful as well.
Mm-hmm. So Matthew, I don't know if you mind, there's 1 or 2 more on here that I wanted to make sure we share.
Yes, no, right. Yes, I've been scanning, but if you see them, please.
Yeah, these are towards the bottom. They're coming in now. And this might be for Amanda, but how stressed have hospital staff generally been these past couple of months? And I think this one's related. Is it hard to ask them to remember the new ways of doing remote advocacy if they are really stressed out?
It's a great question. Yeah, I think it's really dependent on kind of the hospital, but it's definitely something I think to take into consideration. And when we first started, I would say the first 4 to 6 weeks, it was pretty stressful. So I think really anticipating having to talk through your new procedures every time you're talking to that hospital, most likely you're going to be talking to a different staff member. If you're able to write an email out and have that be sent out to your liaison who can then kind of distribute it, that can also be helpful, or printed up instructions so they can kind of put at the kind of milieu for folks to see as well. But I think also remember to kind of go slow, have compassion, and just anticipate really being able to also shorten your script for providers as well, and knowing that they're taking on a lot more and they might have heightened emotions.
Yeah, that's really great. And I can't speak from any experience, but I would also guess that the providers are probably somewhat relieved that you're all still able to provide some services. I know that in general that the advocate role is super helpful for the medical staff as well, as they don't always have that specific training, and also are just so busy. So I'm sure to some degree they're incredibly appreciative that this is still an option for survivors.
Yeah, and it's been helpful to help kind of bridge the gap from, they arrive and then are able to speak with us over the phone before the scene nurse gets there. So kind of really seeing ourselves as part of a team to really be there to support the survivor.
I see a comment here from Hilda in Connecticut that they are using video conferencing, which I think, several folks said they were doing when we did our poll earlier. And that, of course, is similar in some ways to the phone accompaniment that we've been talking about. I'm sure it also has some additional layers that maybe it could serve as part of a future training. I think that at least from my limited perspective, I've heard about it happening so little that it has not seemed like the most like it would be the biggest training need, but it's possible that that it's something that's going to continue to grow and become more common here. So we'll keep our eyes on that. And Hilda, if you're still on, you can type into the chat box. Is there anything that's specifically challenging about that the video advocacy? And I'll and she may type in a minute or two here. She may.
And just a quick note, I know this isn't one of our next our closing slides, Matthew, so I'm sorry to skip ahead, but I just want to point out there's a couple of folks who have shared that they're having a lot of struggles with their facilities in terms of communication and training. So we do provide a JDI TA and the PRIA Resource Center as well. So just encourage you all who are sharing some of those struggles to really reach out to us after this webinar to see how we can support you all.
All right. Well, you will all, I should say that everyone will receive an email in the next hour or two that will contain some contact information. If there are any questions that come up that you weren't thinking about now, but do come into your mind later, you can always reach out to us via that email. And I think, Nick, do you think we can move on?
Yeah, just it looks like I want to share here.
Tim video Cox, we did hear back from Hilda.
Oh, okay, and real quick, just Tim Cox shared that the Maryland Coalition Against Sexual Assault is putting an Introduction to Fundamentals, a 12-hour training for advocates, if anyone would be interested. Shout out to Tim. Several of us in the DC office live in Maryland, so thank you
for sharing that. No, it's great. It's a neighborhood connection. And Hilda, thank you for writing back. Hilda lets us know that the video conferencing program, it was begun so that victims who could not testify or present in court with an offender, it was begun for that reason, to fill that need, and that it should be extended to incarcerated survivors to connect with advocates and programs. Yeah, I think that makes sense. And it seems like a good tool.
Yeah, and I can speak to that this is something JDI has also been looking into for some of the services that in-person services that we provide specifically in California. So thanks for sharing that, Hilda, and we appreciate the work you're doing to make that happen for folks.
All right, as promised, more information. You can always visit our advocate resource page, justattention.org/advocate-resources. You can direct any questions to advocate@justattention.org. And we are on social media. Oh, and I will have to apologize to Allison, our comms assistant, who has been urging us to include our Instagram account. We now have an Instagram account. And I left it off this slide, so I will apologize to her. But we are on Instagram, and if you look us up on Instagram, you should be able to find us if you do a search for Just Detention International. We'd love it if you would follow us and make us a part of your feed. And we want to hear feedback from you on this discussion. The email that I talked about before will include a link to a survey. It takes about 2 minutes to complete. We always gain from knowing what we did right, what we did, what we could have improved on. So thanks in advance for helping us to refine our work. I want to thank Tanji Reese, Nicole De La Torre, Amanda Drapcho, and all of you for joining us today. We hope that this has been helpful for you. This presentation will be recorded, has been recorded, and it will be uploaded to JDI's website shortly. We hope everyone has a good day. Stay safe, be well, keep up the fight.